So avascular necrosis is often when you have the femoral head and the blood supply that is delivering oxygen and nutrient to the femoral head is disrupted. So the femoral head can't grow, it slowly gets necrotic, and then it starts to shrink. If it shrinks, can you imagine the femoral head will kind of just fall off your hip socket, right? So that's not something good. So what we then look into is that if you have a femoral head that is avascular, what the surgeons can do is to drill a hole across here, and we can make our hydrogels in syringes. So this is the gel precursor solution, shine them under light, then you can put them very easily just back into the canal where we've just drilled the hole. So we can use this as a way to targetly deliver the growth to the growth plate within femoral head. So this is kind of just show what it looks like. So when you drill the hole, you form this tunnel here. This is after you inject the gel. You can see that the gel now fills up this tunnel. This is from side, top side view. We have them just to prove that the gels are definitely filling up the canal in this case. And it is really quite amazing to look at the difference in terms of the tissue regeneration, where this is sham, where we kind of just drill a hole and we didn't really treat much. You can see the samples now are slowly shrinking. You can see necrotic lesions now happening within them. This is a healthy control where you see really nice preservation of your femoral head. The cartilage layer stays intact, and then beautiful porous structure of the bone is still there. And in the gels that we drill a hole and then inject the hydrogel with the growth factor. In this case, you can see in the treated gels, you also get really nice preservation of the cartilage, also preservation of the overall femoral head shape. So this is showing that the same material, you can mold them into a disc for rotated cuff. You can also use them as injectable material, deliver it into areas that are hard to get to, and in this case, still deliver growth factor of interest to then get better of the femoral.